So let's just first, it is an introductory class and we will tell what is this pharmacology is, what are the different terminologies of the pharmacology, and what are the different nomenclatures of the drugs, how the drugs are named, etc. So let's just first start with the pharmacology. Already you have read about the anatomy, physiology and biochemistry. So in the anatomy you have read everything about our human body. In the physiology, how the physiological processes are happening, and biochemistry also different biochemical reactions that is necessary for our survival. Now in the pharmacology, that is the main part of your treatment, that is the main part of your management or prescription, and this knowledge of the pharmacology will be needed lifelong, and this pharmacology is not a static one. Newer and newer drugs are continuously being added. Newer updates about the drugs are continuously be added. We are knowing that this drug may cause this type of adverse event. Again, this is continuously changing dynamic subject, and the knowledge of the pharmacology is important for safe prescribing, appropriate management of the patients, and ultimately well-being of the patient. So let's just start. So pharmacology is basically study of medications. So medications, in most of the cases, it is a chemical compound, a exogenous product. But the more you will proceed into your second professional MBBS, you will see that apart from the chemical compounds, there may be different other types of the drugs also. For example, there may be nutraceuticals, some nutrient products. There may be some biologicals, that is those drugs that come from some biologicals. For example, monoclonal antibody, different types of the vaccines, etc. So there are different types of the drugs. The most commonly it is a chemical compound, and that interact with various living system. That is when we are introducing a component or a drug that interacts either with the molecule of our body or cells of our body or tissues of our body or ultimately organism. Organism means some exogenous organism, for example bacteria or virus. So it can act on our tissue or our organ system if there is some pathology, or it can act on some exogenous organism that can cause different types of the diseases. So all this comes under drugs. Apart from this, there are some diagnostic purposes of the drugs also. So you can see that there are contrast medium that is usually done in case of the CT scan or MRI. That is also a drug. So drug is not only for the therapeutic purpose, that can also be for some diagnostic purpose or some prophylactic purpose also, like that of vaccine. So when we are giving a vaccine to anybody, the person is well and fine, but we are giving vaccine so that the disease will not happen. So all this comes under the purview of the drugs. That is, ultimately they produce some effect, certain effect. That effect may be to kill the microorganism that can cause the disease. That effect to reverse some biochemical processes that ultimately causing the disease. For example, there is hepatitis. That effect may cause different types of the effects that ultimately leads to healthy well-being of the individual. So pharmacology basically comes from the Greek term. Greek pharmakon means drug and logos means discourse in, that is analysis, discourse. Discourse in drugs. So this is basically science of drugs, pharmacology. In a broad sense, it deals with the interaction of exogenously administered chemical molecules with living system. That is, we are introducing some exogenous material by oral route or by IV route, or different types of the routes are there, you will read. We are introducing some products from outside so that they will cause some effect in our living body. So which can produce some biological response. And pharmacology encompasses all aspects of knowledge about drugs, but most importantly those that are relevant to effective and safe use of the drugs for medicinal purposes. So what will be our motto? Our motto is to treat the patient and to treat in such a way so that the adverse effects will be minimum, that will be safe as well as the effective for the patient. So these interactions between the drug and the human body, this usually occur by binding of the substance to regulatory molecules. So there are different molecules, different receptors, different proteins, enzymes are there. Already you have read some of this in the physiology, biochemistry, anatomy. So these drugs can act on different these systems. So ultimately they occur by bind with these systems and activating or inhibiting normal body process. So it may happen the body may give some responses that may be hyperactive. So we have to also decrease the normal body response. For example, in some autoimmune disease, in some anaphylaxis, in some allergy. So again we are giving some drugs so that can modify, that can activate or inhibit the normal body processes. These substances may be chemicals administered to achieve a beneficial therapeutic effect. Therapeutic effect means when we are using some drugs for some therapeutic purpose, that is our purpose is known. That is, for example, there is typhoid fever, there is infection, our purpose is to treat the infection like this. So this is the therapeutic effect on some process within the patients or for their toxic effects on regulatory processes in parasites infecting the patient. Already we have discussed. So such deliberate therapeutic applications may be considered the proper role of the medical pharmacology, which is often defined as the science of substances used to prevent, diagnose and treat. So pharmacology or the drugs not only about only the treatment or management, but also to diagnose, also to prevent the disease. And mainly this pharmacology contains two broad subdivisions. One is pharmacokinetics, one is pharmacodynamics. Pharmacokinetics means what the drug, what the body and drug, there are different types of the interactions, and these two-way interactions are mainly represented by pharmacokinetics and pharmacodynamics. What are these? So firstly you can see that there are different types of the ways by which a drug is given. Details you will read later. There are some can be shown in the picture, like there may be some oral route, you know, oral route can be tablet or there may be capsule. Apart from this, there may be some inhalational route. Some of you in some family there may be some asthma or COPD where they are using inhaler. So this is given by inhalational route. There may be ocular route, some eye drops or something is given. There may be otic route when it is given in the ear. Parenteral means when we are injecting something apart from these routes, like that may be intravenous, that is when it is introducing within the venous route. Intramuscular, when it is given in the muscles. Subcutaneous, that is under the cutaneous layer when it is given. There may be some sublingual or buccal application, that is under the tongue or on the mouth. Some drugs are given. There may be transdermal patch, that is it is like an adhesive that can be added on the skin, and from the skin the drug can be absorbed from the skin. So this is a transdermal patch. There may be epidural, that is dura mater. Dura mater you know. So epidural, usually this is used in case of the anesthesia. Epidural anesthesia can be there. Topical application you all know. There may be some ointments, there may be liniments, different types of the powders that can be given topically. Rectal administration can also be done. There may be different types of the enema, etc. there. So there are some of the ways by which drug can be given. So now coming to the pharmacokinetics. So when the drug is given, pharmacokinetics means what the body does to the drug. So by these different types of the means, we are introducing some exogenous substance, that is the drug. Now when this drug is introduced in our body, how our body responds to the drug, what will be the changes to the drug that is happening due to our body processes. This all comes under the purview of the pharmacokinetics. So pharmacokinetics refers to the movement of the drug in and alteration of the drug by the body. So already we have been, when we are taking some drugs by oral route, that drug ultimately comes in the from the tongue, that comes to the esophagus, then comes to the gastric juice, then comes to the intestine. So in the gastric juice, how this drug behaves, how much amount of the drug is absorbed, how much amount comes to the intestine, how much comes to the blood by absorption, all this comes under the pharmacokinetics. And after this absorption, how the drug is distributed to our body, distributed to the area where the drug is needed for its action, and then metabolism of the drug happens, and then ultimately elimination of the drug happens. The elimination can happen through the stool, through the urine, different other ways. So all this happens due to the actions of our body on the drug, movement of the drug throughout the body. This all comes under the pharmacokinetics. So for example, you all know about the paracetamol. When there is fever, we will ingest the paracetamol. So this paracetamol is rapid and almost completely absorbed, orally attaining peak blood levels. So you will all read about this in the pharmacokinetics chapter. This is just a nutshell how we will discuss pharmacology. So this paracetamol, when it enters within the blood, peak blood levels, that is the maximum amount of the plasma concentration, happens in 30 to 60 minutes. 25% of this paracetamol is bound to plasma proteins, and it is widely and uniformly distributed in the body. That is distributed in different tissues of our body. Volume of distribution, from this is a parameter from which how the drug is distributed is known. That is quite high, approximately 1 liter per kg. Then it is extensively metabolized in the liver. You all know from the physiology and biochemistry there are different types of the enzymes that causes the metabolism in the liver. For example, cytochrome P450 enzyme. You all know about this. So this metabolism happens in the liver, and after this metabolism happens, for example, in paracetamol, there will be glucuronidation. That is glucuronide conjugate is added to the paracetamol. Sulfate conjugation is added to the paracetamol. So ultimately that will become inactive, and these inactive molecules are excreted in the urine. So ultimately there is another parameter, this is known as the plasma half-life, from which we can determine what will be the frequency of the dosage. So plasma half-life is approximately 2 to 3 hours. Clearance is also another parameter you will read in the pharmacology, pharmacokinetics, that is approximately 5 ml per kg per minute. These all are very important when we are using the drugs. So from this pharmacokinetics we can know that what will be the doses, what dose should be given, what will be the frequency of the dosage. All this can be covered by the pharmacokinetics. For example, if there is some renal compromised patient, the elimination will be lesser. So that's why we have to decrease the dose of some drugs that is basically eliminated to the kidney. There may be some problems in the liver. For example, there may be some hepatitis or some liver disease where the metabolism will be deranged. In those cases also we have to decrease the dose or something like that. So all this comes under the pharmacokinetics, how the dosing, frequency of the dosing can be done so that the maximum plasma concentration will be attained in the target areas and maximum effectivity will happen. So you can see this is the 4 main pillars of the pharmacokinetics: absorption, distribution, metabolism and elimination. Already I have discussed, when we are taking a drug, that may be oral drug, that may be injectable drug, ultimately they have to be absorbed within our body. So absorb means it have to be come within the blood, and from through the blood it will go to the different areas so that their activity will happen. So absorption input, after the absorption it has to be distributed in different areas, and accordingly some drugs are distributed in some tissues, some drugs are distributed in different other tissues, and accordingly the drugs are chosen. And after the distribution there may be some tissue distribution, the distribution in the plasma, there may be what will be the ratio of all these are needed in the pharmacokinetics, ratio in the plasma or ratio in the tissue. And then metabolism, already we have discussed, metabolism mainly happens in the liver or some other organs, and then it is eliminated. So absorption, distribution, metabolism and elimination, these are the 4 main pillars of the pharmacokinetics. So pharmacokinetics means what the body does to the drug, what the body does to the drug. Okay. Now coming to the pharmacodynamics. So after the pharmacokinetics, so when the drug is absorbed, now the effect of the drug have to be manifested, so that those therapeutic effect which we intend to get have to be there. So pharmacodynamic means what the drug does to the body. So previously pharmacokinetics means what the body does to the drug, how the drugs are moved within our body, different phases. And after that pharmacodynamic means what the drug does to the body, that is what changes in the physiological or biochemical changes will happen due to the effectivity of the drug. So just opposite, pharmacokinetics, pharmacodynamics, what the drug does to the body. So this includes physiological and biochemical effects of the drugs. So already in the physiology and biochemistry you have seen that there are some drugs that can change some physiological process, some biochemical process. So in the pharmacokinetics, when the drug is absorbed, after absorption that drug ultimately comes to some other organs, and then they attaches with some receptors, and then after that receptor attachment there will be some changes in the physiological or biochemical processes or some stepwise cascade, so that there are different messenger system you will read, and after that there will be some therapeutic effect. So this includes physiological and biochemical effects of the drugs and their mechanism of action at organ system, there may be subcellular or macromolecular levels. There are different types of the drugs at different areas. That may be macromolecular levels or micromolecular levels, different steps of the biochemical pathways, different other organs also. So for example, adrenaline or epinephrine is a drug. Again, this is usually given by intravenous or subcutaneous route, and after absorption, it interacts with adrenoceptors. So adrenaline receptors are there in different organ systems. They interact with this. When this interaction happens, there will be activation of some second messenger system. So there will be different second messenger system that helps in changes in the physiological or biochemical processes. For example, here the G protein coupled receptors are usually activated. This is a second messenger system that ultimately stimulates the membrane bound adenylyl cyclase. Adenylyl cyclase is a very common second messenger system that increase intracellular cyclic 3'5' AMP, and then ultimately this leads to changes in the electrical stimulus, changes in the biochemical parameters as well as the neurotransmitters, so that there will be cardiac stimulation, hepatic glycogenolysis, hyperglycemia, etc. This is just to give you a glimpse how a drug acts, what is pharmacodynamics actually means. So this means how this adrenaline causes the cardiac stimulation. So the previously pharmacokinetics means when we are giving the adrenaline, how it is absorbed, metabolized, eliminated, distributed in our body, and pharmacodynamic means when this adrenaline is given, how it causes the cardiac stimulation, or in the liver, how it causes the hepatic glycogenolysis, or how it can increase the blood sugar level, because this adrenaline increases the blood sugar level. All this comes under the purview of the pharmacodynamics. So this is very important for your exams also, what is pharmacokinetics and what is pharmacodynamics. Okay. So for example, this is a receptor, you know from this in different biochemistry books also. So unoccupied receptors does not influence intracellular processes. So the receptors are there, but when there are some ligands can come, ultimately the receptors are activated. Now these ligands may be some physiological ligands also, normal physiological ligands, and these normal physiological ligands cannot act properly. We have to give some exogenous ones, or we want to replace the normal physiological ligand, so we are giving some competitive drugs that can replace the normal ligand, and then drugs attaches with the receptors and ultimately activates the receptors like this. So receptor with bound agonist. So what it attaches, what these different types of the ligands that causes changes in the receptors, this is known as the agonist. So this agonist, bound agonist, receptor bound agonist, you can see this is activated. So some drugs come, this acts on the receptors, this receptor bound agonist is activated. So it has altered physical and chemical properties, which leads to interaction with cellular molecules to cause a biological response. So you can see receptor, this drug attaches with the receptors, and ultimately there will be activated receptors, there will be some second messenger systems are activated, and ultimately some biological response ultimately happens. This also this is known as the signal transduction. So this is pharmacodynamics. So this is the pharmacokinetics, the four main ways by which the pharmacokinetic parameters are usually measured, and this is the pharmacodynamics. Now coming, what is drug? Drug bolte amra ki bujhi? So drug basically comes from the French word drogue. Drogue means a dry herb. So previously you all know that there are different types of the herbal ways by which they are treating previously, and from these different extracts are prepared in the modern days, and from these extracts also different drugs are prepared, and also we are preparing different chemical compounds that can mimic the different physiological ligands, and we are getting different types of the drugs. So it is a single active chemical entity present in a medicine that is used for diagnosis, prevention, treatment or cure of a disease. Already we have discussed. This disease-oriented definition of the drug does not include contraceptive or use of drugs for improvement of health. So previously it means, drug means we are only treating a patient, but already we have discussed drug also encompasses vaccines, drug also encompasses contraceptives, drug also encompasses different sort of diagnostic dyes. So these are given in the healthy persons for some diagnostic purpose, for some prophylactic purpose. That is also comes under the drug. So WHO in 1966 has given a more comprehensive definition. Now this definition of the drug is very important. It is usually asked in the viva, and this is quite commonly asked in the examination. So drug means, drug is any substance or product that is used or is intended to be used. It is used because we are giving some drugs, but there may be some adverse effect. So basically we are giving some drugs with good intention, but there may be some bad things happening, or the drug will not respond to that physiological system, because every humans are different and it is no mathematics. So that for the same disease, same dose of the drug can act in one individual and in another individual it cannot act. It is not 100%. So, but that is, this intended to be used term is also included within the drug. So, it can happen that some drug is given that is not doing any adverse effect, but that is not doing any good effect also. So, our intention is to treat the disease. So, the substance and product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. So, ultimate aim is the benefit of the recipient. That may be diagnostic purpose. So, we are giving some drugs for diagnosis, basically to see that whether this disease is present or not, and then we can treat. So, ultimately our goal is the benefit of the recipient, and for this we are using drug which is a substance and product that is used or is intended to be used to modify or explore the physiological systems or pathological states. Okay. So, this is very important. So, this term drug, you all know that this also means to use some addictive or abused or illicit substances. So, that may happen. So, this restricted and derogatory sense use this unfortunate degradation of a time-honored term, because in the for the lay person, drug means some illicit substance, but it is not that. Drug means all the medicinal substances. Nevertheless, to avoid any misinterpretation, the term medicine is sometimes being employed to designate a substance in place of the drug. So, in the letter you can see this medicine is given or this drug is given. This medicine and drug, these two terms can be used interchangeably. Okay. Next, coming some terminologies like pharmacotherapeutics. So, now this pharmacological knowledge is used in the therapeutics. So, it is the application of pharmacological information together with the knowledge of the disease for its prevention, mitigation or cure. Pharmacotherapeutic approach. So, we are using the information with the knowledge of the disease. So, we know this disease causes this type of pathology. Now, we are using this drug in this dosing so that this pathology can be corrected. Selection of the most appropriate drug, dosage and duration of the treatment is done taking into account the stages of the disease and the specific features of a patient. These are all part of the pharmacotherapeutics. So, pharmacological knowledge used in therapeutics, therapy of some disease. Next, coming to the clinical pharmacology. Clinical pharmacology is basically the scientific study of the drugs, both old and new drugs in man. So, when we are using some drugs, particularly first it has to bypass the different types of the scientific research or clinical trials. First, it is done in some animal models to see what will be the dose, what will be the safety. Then it is done in the human models. There are different phases of the clinical trial, you will see later. So, this all encompasses within the clinical pharmacology, and it includes the pharmacodynamic study, pharmacokinetics study. These are all investigations. These are done first in the healthy volunteers to see how the drug is absorbed, distributed, metabolized, eliminated, and then it is given to the diseased person to see how this behaves, what is their safety, what is their effectivity. So, basically this is a evaluation of the efficacy and safety of the drugs and different types of the comparative trials. So, we are doing some drug trials with other forms of the treatment, surveillance pattern of the drug use, adverse effects, etc. So, all this comes under clinical pharmacology. So, we are testing the drugs to the humans, to the animals, or mainly in the humans in different phases to see how the drug behaves and how the body behaves to the drug also. So, the aim of the clinical pharmacology is to generate data for optimum use of the drug and the practice of the evidence-based medicine. So, what will be the evidence? So, evidence means there are different types of clinical trials. This data is the evidence. From this data, more and more data is gained so that the drug, when it is given to the human subjects, there will be more effectivity and less adverse effects. That is the aim. Now, coming, what is the chemotherapy? Chemotherapy is the treatment of the systemic infection. So, when we are treating some infection, that also comes under the chemotherapy. or when we are treating some malignancy like cancer, that also comes under the chemotherapy. So chemotherapeutic agents means not only the cancer chemotherapeutics but also the microbial chemotherapeutics. That is commonly some antibiotics or antiviral drugs or antifungal drugs, what we are using against some bacteria, virus or fungus, this all comes under the chemotherapy. So they have selective toxicity for the infective organism or malignant cell with no or minimal effects on the host cells, because here we are using some exogenous substances to kill or diminish the effect of some other organism that resides within our body. So we are using antibiotics to kill some bacteria within our body, so that our aim will be, when we are using that antibiotics, the harm to our normal cells, normal host cells will be minimum, but that will be maximum damage to the bacteria. That will be the aim. This comes under the chemotherapy. So drugs in general can thus be divided into pharmacodynamic agents and chemotherapeutic agents. Pharmacodynamic agents means they are designed to have pharmacodynamic effects in the recipient, that is within our own body they are changing some physiological processes or pathological processes, and chemotherapeutic agent means they are designed to inhibit or kill some invading parasite. Malignancy or cancer also behaves like that of some microbes, that is some other things that ultimately grows out of hand. So for this invade, they are also invading. The invading parasites or malignant cells can be tackled with the chemotherapy, but they should have no or minimal pharmacodynamic effects on the recipient. That is minimal effect on our own tissues, own cells. Okay. Now coming, what is the pharmacy? Pharmacy means the art and science of the compounding and dispensing drugs. How these drugs are compounded, how these drugs are formed, how these are dispensed. This comes under the ambit of the pharmacy. How the suitable dosage forms for administration of the drugs to mans and animals. So it includes basically collection, identification, purification, isolation, synthesis, standardization and quality control of the medicinal substances. So what we are prescribing, after that there will be pharmacists, they can dispense the drug, what will be the dosage etc. they will dispense. But apart from this pharmacy also encompasses how these drugs are manufactured, how these are formed, how the different dosage forms are made, all this comes under the pharmacy. So the large scale manufacture of the drugs is called the pharmaceutics. So large scale in the industry, number of the billions and billions of the paracetamol for example are created in different types of the manufacturing hubs. So all this known as the pharmaceutics or pharmaceutical industry, which is primarily our technological sciences. Next, coming to the toxicology. Toxicology is the study of poisonous effect of the drug and other chemicals, like there are some household chemicals, there are some agricultural chemicals, industrial chemicals, environmental pollutants, some can be used as a homicidal agents. All this comes under the toxicology with emphasis on its detection, prevention and treatment of the poisoning. How the poisoning happens with this drug, what will be the mechanism of action, what will be the dosage that will cause the poisoning, or below this that will not cause the poisoning or that will be help as a drug. All this comes under the purview of the toxicology. For example, you know about the term thallium. Thallium is a very poisonous substance when it is given in some more doses. But when this thallium, you can see this is also used in diagnostic purposes. There are some thallium CT scan or different types of the MRI scan, gadolinium scan. These are also done by means of the thallium. But the doses are the different. So when the dose are different, the same thing can become very beneficial our body and the same thing can be very much toxic. So thallium, you can see that you have probably some of you have see the James Bond Spectre in 2015. Here the thallium is used as a main poison, Spectre, James Bond. Okay, so that thallium is very commonly used as a diagnostic purpose in our ways. So it includes the study of the adverse effects of the drugs, since the same substance can be a drug or poison depending on the dose. Depending on the dose, the same substance can be drug or poison. Now coming to the nature of the drugs. All drugs are chemical entities with simple or complex molecules. There may be simple molecule, complex molecule, there may be different types of the side chains are added. All these are the chemical changes, chemical modifications are done to the drugs. While majority of the organic compounds, some are purely inorganic, like lithium carbonate, ferrous sulfate, magnesium hydroxide. So these are purely some metal ions that are also given. For example, ferrous sulfate is given in iron deficiency anemia. When there is iron deficiency anemia, we have to use some ferrous salts, ferrous sulfate like this. Lithium carbonate, lithium is used in bipolar disease like this. Organic drugs may be weakly acidic or weakly basic. There may be some non-electrolytes, different types are there. Weakly acidic drugs like aspirin or penicillin, weakly basic drugs like morphine, chloroquine, non-electrolytes like alcohol, diethyl ether, etc. So all these are needed, how the drugs will behave in our body. So accordingly, weakly acidic drugs and weakly basic drugs, how it is absorbed, because our gastric juice is acidic, but the intestinal ones in the basic. So accordingly, the nature of the drugs in such way it is given so that the absorption will be maximum. Most drugs are normally solids, example paracetamol, propranolol, furosemide, ampicillin, you will see all of this. But some such as ethanol, glycerol trinitrate, propofol, castor oil, these are liquids, and few like nitrous oxide are gaseous. So drugs may be not only a solid substance, that may be a gaseous substance, that may be a liquid substance, that may be in the ointment form, everything. The molecular weight of majority of the drugs falls in the range of 100 to 1000 Dalton. Because molecules smaller than 100 Dalton do not generally have sufficiently specific features in terms of the shape, size, configuration, chirality, distribution of charges, etc. to selectively bind to only one or few closely related target biomolecules or to the exclusion of drugs. That is, what will be the size of the drug? Size of the drug particles is also important. Usually it is in the range of 100 to 1000 Dalton. Because if it is less than 100 Dalton, very small molecule drug will not act properly. On the other hand, there may be some large molecules drug, large molecules that is greater than 1000 Dalton do not readily pass through different types of the membranes or the barriers in the body to reach the target sites in various tissues or cells. That may happen. However, there may be some few drugs that is very small, like lithium ion, 7 Dalton can also be used. Some heparin, heparin is very large molecules, approximately 10 to 20 kilodalton. Gonadotrophins, enzymes, proteins, antibodies, much bigger usage are also there. Bulky molecule drugs have to be administered usually parenterally. So you have to use it as a intravenous or intramuscular form or subcutaneous form. So this is basically to give you an idea that the drugs may be by different shapes and sizes, and this is also important because for which pathology we are using this drug, because it may happen that we do not want to absorb the drug in some of the cases, because that drug can act only on the gastrointestinal system. So we are giving some drugs that will not be absorbed. So that there may be, we want to some gut clear, for some gut clear we are using that. So according to the therapeutic usage of the drug can be used. What will be the range sizes of the drug, what will be the, that is also important. Chirality, chiral, that is levoisomer or dextroisomer, that is also important. Distribution of the charges, all this can be taken care of. Drugs are generally perceived to be chemical substances foreign to the body. So xeno is used when some foreign materials is there, xenobiotics. So we are using some drugs that is outside of our body. So we are using some xenobiotics. However, many endogenous chemicals are also used, like some hormones, autocoid metabolized nutrients are also used as drugs. For example, thyroid hormone, hypothyroidism. Some of you are ingesting some thyroid hormones or in your house, some are taking some thyroid hormone. So when there is hypothyroidism, that means the thyroid gland secretes less amount of the thyroid hormones. So we are just supplementing some thyroid hormone from outside. So basically this thyroid hormone is also present in our body, but since this is secreted less, we are making it in a tablet form. We are making in such a way so that there will be absorption and we are ingesting this. So basically this is an endogenous material. We are just incorporating from the outside. Chemical congeners of these metabolites of signal molecules are an important class of drugs which act by modifying the synthesis, storage, degradation or action of these metabolites of signal molecules. So same thing, so that there will be some signal transduction, changes in the signals happens. So drug can obtain from the plants. Many plants contain biological active substances, that is there may be some alkaloids. Alkaloids are the alkaline nitrogenous bases having potent activity. And most important category is the vegetable origin drugs. Example is the morphine, atropine, ephedrine, nicotine, ergotamine, reserpine, quinine, vincristine. This all comes from the plant sources. Mainly these are the alkaloids. They are mostly used as their water soluble hydroxychloride or sulfate salts. Again, there may be some glycosides. So these are different biochemical differentiation. Glycosides are basically heterocyclic non-sugar moiety. Ag-glycon ring is there. Glycosidic bond is there. We have read some of this in the biochemistry. So this is linked to a sugar moiety through ethyl linkage. So cardiac glycosides, example digoxin, uabin, these are the glycosidic drugs. The active principle of the senna and similar plant purgatives, that is, these are used mainly in the case of constipation. Purgatives are used in constipation. These are also glycosides, anthraquinone glycosides. There may be aminoglycoside antibiotics. This is a group of antibiotics, aminoglycoside like gentamicin. This can be obtained from the microorganisms also. That is, from the microorganisms enzymes we can prepare some drugs that can help also. So these are obtained from the microorganisms, and this is also glycosidic drugs. There may be oils like viscous inflammable liquids like fixed and non-volatile oils. These are the calorie yielding triglycerides of higher fatty acids, mostly used for food as an emollient like groundnut oil, coconut oil, sesame oil, etc. Like castor oil. This is basically an oil. This can also be used as a drug. Essential or volatile oils are mainly obtained from the flowers. We can distill it. Some fragrances there, mostly there is no food value of this. This can be used as a flavoring agent, carminatives, counter irritants, astringent, etc. For example, eucalyptus oil, peppermint oil, etc., etc. And when a drug is manufactured, the drug not only contains the active substance, there are some other substances that ultimately helps to form a drug. These are known as the excipients. For example, there may be some coloring agents so that you will see the color of the tablet. There may be some binders. There may be some other chemical substances given so that the drug will not be disintegrated when it comes to the gastric juice. That is acid resisting substances. That's why there may be some gelatinous substance can be given, like capsule is made. So drug not only contains only the active drugs, this all also comes with this. These are known as the excipients. So drugs plus excipients, what we are seeing. And it may happen that some persons may be allergic, there may be some problems with the excipient also, not only the drug. So that may be a problem. Mineral oils that can be obtained from the minerals. This is not plant products, obtained from the petroleum. Liquid paraffin, for example. Liquid paraffin can also be used as a drug. There may be other plant products like tannin, gums, etc. Details is not required. Glycerin. Glycerin is basically a liquid, viscous sweet liquid, mainly used as a gum or throat paint when there is irritation. Resins, balsams, these can be used as an antiseptic and cough mixtures. Antimalarial drug artemisinin is basically obtained from a Chinese plant. Artemisinin derivative is now the main treatment for the malaria, which usually obtained from the Chinese plant. And there are animal origins of the drugs is also there. For example, this adrenaline, thyroxine, insulin, some liver extracts, vitamin B12. These are extracted from the different types of the animals, then distilled, then ultimately manufactured. Antisera and few vaccines are also produced from the animals. Different types of minerals already we have seen. We are giving some iron tablets for the anemia, iron, calcium salts. When there is some osteoporosis, we are giving some calcium. These are medically different types of minerals. We are ingesting different types of the antacids, most commonly gelusil like this. They mainly contain magnesium or aluminum hydroxide. So basically this is a mineral. So, and from the microbes, different types of the antibiotics are usually got. For example, penicillin, gentamicin, tetracycline, actinomycetin D, polymyxin B, etc. Different types of the antibiotics, different types of the cancer chemotherapeutic drugs that can be obtained from the microbes. Some enzymes can also act as a drug. Some vaccines are produced from the different types of the microbes and different minerals already we have seen. Synthetic chemistry. Now, purely from in the laboratory, by means of the synthetic chemistry, newer drugs are formed so that that drug can act on different physiological processes or pathological processes. Congeners of the naturally obtained drugs are also used. So, naturally obtained, that congener, that is that natural substance is present in our body, but some congener, some side change is added, some chemical modification is done so that that can be used as a drug. That can be also happen. Entirely synthetic families of the drug is also there, like benzodiazepines, thiazides, etc. Many drugs are being synthesized to target specific biomolecules. That is, first we are seeing the target and for this target what drug can be beneficial, that drug can also be invented. There are several of such drugs. For example, ACE inhibitor, glycoprotein GP2B3A receptor antagonist, etc. That is, by different ways the drugs are usually manufactured, and the recent ones are the biotechnological drugs. So different types of the, by help of the biotechnology, monoclonal antibodies, different types of the biological drugs, oligosense nucleotides are formed by means of the DNA technology, all these drugs. Now protein therapeutics have also come in, that is rapidly expanding, so that there will be customized drug, gene therapy, that is only this drug will happen is a individualistic, that is this can act only on one individual whose genetic makeup is like this. Genetic drugs, newer drugs, more target specific drugs, this is the future. Now coming to the drug nomenclature, how the drugs are named. So basically there are three types of the names. First is of course the chemical name, that is what is the chemical composition of the drug, chemical name, that is quite cumbersome and quite large. Next is the non-proprietary or generic name. Non-proprietary name or generic name is the common name that is used throughout the world, because that we know paracetamol, if in some other languages, in some other country, that paracetamol is known by some other names, and like this there are 100 names of the paracetamol, it will be cumbersome. So that there will be a non-proprietary or generic name, that is a common name, also known as the common name. And lastly the proprietary or brand name. Brand name means that company is giving the name, and the brand name may be variety. There may be different, for the same paracetamol there may be some Calpol, there may be Parapasic, and in different countries the same drug can be manufactured and marketed by different other names also. This comes under the brand name. So three types of the names: chemical name, non-proprietary or generic name, and proprietary or brand name. So chemical name example is like this long one. This chemical name is not needed for us medical students. This is for example, this one isopropylenamino 3-naphthoxypropan-2-ol for propranolol. This propranolol, this is a beta blocker. This is the non-proprietary or generic name, propranolol. And this is the chemical name, this all one is a chemical name of this propranolol. And this propranolol is also marketed in different types of the brand names. For example, Inderal is a brand name of the propranolol. So this chemical name is quite cumbersome, not suitable for use in prescribing. So firstly, when a drug coming to the market and different types of the clinical pharmacological trials are ongoing, first this type of the name is given, like some numbers, and then when this drug is marketed and some generic name is given, and that is sent to the WHO, and there are expert committee of the WHO that ultimately determine for a new drug. For a new drug there is no generic name, that this can be the generic name, this can be the non-proprietary name that can be used throughout the world. That's how the generic or non-proprietary name is used, mainly for the convenience. So non-proprietary name, it is the name accepted by a competent scientific body or authority throughout the world. Non-proprietary name or generic name or common name. Example, the United States adopted name by the US and Council. Similarly, there is the British approved name of a drug. So there are some drugs that have some 2 or 3 drugs previously, but in most of the cases now there are only non-proprietary name is one for one drug. The non-proprietary names of newer drugs are kept uniform by an agreement to use the recommended international non-proprietary name. This is known as the RNN, recommended international non-proprietary name, INN, it is known as that. And this is mainly controlled by the WHO, and this is mandated for all the WHO delegated countries. This name of older drugs has now been modified to commensurate with this international non-proprietary name. So previously this WHO has adopted this in the 50s. So previously there may be different types of the names of the drugs, particularly there are some American names and British names. Some of these are also there, but in most of the cases this is ultimately mitigated to come in agreement with this international non-proprietary terms. For example, meperidine and petidine, lidocaine, lignocaine, there may be some change, some dual or thrice named drugs are there, but in most of the cases you have to read about the international non-proprietary name of the drug or the generic name of the drug. Until the drug is included in a pharmacopoeia, the non-proprietary name may also be called as the approved name. So first when it comes, what I am telling, it is the approved name, and then the WHO mandated it. After its appearance in the official publication, it becomes the official name. In common parlance, this is known as the generic name. What you will see that this is the generic name of the drug. It is basically the international non-proprietary name. That is, paracetamol is the international non-proprietary name. Etymologically, this is basically incorrect. So, generic name is basically used in common parlance, but it is not a scientific term. Generic should be applied to the chemical or pharmacological group or genus of the compound. That is, there are different types of the groups of the drugs for which this generic term is mainly used. Like the group of the tricyclic antidepressant, group of the aminoglycoside antibiotics. This paracetamol comes under group of the non-steroidal anti-inflammatory drug, NSAIDs. So, these can be called as a generic drug. But since it is commonly used, that's why the generic drug or generic name of the drug is becoming the commonly used. This misnomer is widely accepted and used even in official parlance. But remember, mainly this is the international non-proprietary name. Proprietary is the brand name, means what the company is giving to the name, to the drug. So, it is the name assigned by the manufacturers and it is property or trademark. So, trademark is usually obtained, they have patent of using that drug name. One drug may have multiple proprietary names. For example, you know amlodipine. Amlodipine is an antihypertensive drug that is used for hypertension. This amlodipine is an international non-proprietary name, or you can say generic name or common name. This amlodipine is present in different types of the brand names, thousands by different companies in India itself, and in whole world you can say this may be millions names by different companies. This is quite common name. For example, it may be Amlong, Amlovas, Stamlo, etc. So, these are the brand names of the drugs. Brand names are designed usually to be catchy, short and easy to remember and often suggestive. Like low pressure means it is decrease the pressure, for suggesting drug for lowering the blood pressure. Brand names generally differ in different countries, like timolol maleate eye drops. Same drop by the same company may be manufactured and distributed in one country in one brand name, in another country by another brand name. It may happen by the same company. It usually happens. So, even the same manufacturer may market the same drug under different brand names in different countries. In addition, combined formulations have their own multiple brand names. That means when we are using the combination of the drugs. So, 2 or 3 drug combination, this is known as the fixed dose drug combinations, not single drug. Again, the brand name will be different, and also there are different types of the brand names by different companies. So, this is responsible for much confusion in drug nomenclature. So, there are many arguments for using the non-proprietary name in prescribing, like there may be uniformity, there may be convenience, economy and better comprehension. Like propranolol, sotalol, timolol, pindolol, these all are beta blocker, but their brand names have no such similarity. Sometimes the non-proprietary name and brand names have no similarity. So, drugs marketed under non-proprietary name, that is some lesser used companies that do not have any patent of that, they are known as the generic products or generic drugs that may be much cheaper than their branded counterparts, partly because the manufacturer mainly invests a lot of money on promoting the brand name. But the problem is, when a drug is prescribed by the generic name, the chemist is also free to dispense any drug. And since in our country and many of countries in the world also, the quality maintain is quite difficult job because the manpower is less and that is the cumbersome. So, when you are using some generic names of the drugs, the chemist gives some drugs from some lesser companies, lesser known companies, and the drug quality is not maintained. Ultimately, the effectivity will not be good or maybe some adverse effects. So, that is the problem. So, generic name or international non-proprietary name, this should be used mainly in the prescription, but the flip side is when you are using, always there are chances of the problems or not mitigating the problems in case of the patients. So, when we are using some brand names from some reputed companies, so ultimately when some company is using some brand names, they are also liable for its safety and efficacy. So, since they are marketing this, so there may be some responsibility on the part of the manufacturer also. So, that is also good for the patient. So, when a drug is prescribed by the generic name, the chemist is free to dispense the generic product from any manufacturer, but not so when the drug is prescribed by a brand name. Thus, when it is important to ensure consistency of the product, that is whether the quality of the product, quality of the drug is very important in terms of the quality, bioavailability, etc. And especially when the official control over quality of the manufacturer products is not rigorous. That is the problem, because there are so many billions of the people, millions of the companies, so many drugs, but the how many drugs quality control will be probable in our country, and also different other countries also. So it is always better to prescribe by the dependable brand name, but again it should be followed with the generic name or the international non-proprietary name. Now it is usually asked that you can prescribe with the brand name, but you have to write also the international non-proprietary name with this, so that if there is no brand name medicines, the patient will not obtain, the patient can get some other brand of drugs. Now coming to the drug compendium of the drug. So these are the compilations of the information of the drugs in the form of the monographs. Now all the drugs, what we will get, in where we can get all the details of the drugs. So this comes under the drug compendia. Without going into the theoretical concepts, mechanism of action and other aspects which help in understanding the subject. So basically this is a compilation of the information of the drug. That is this drug, this is the international non-proprietary name, and this is the absorption, this is the metabolism, distribution, elimination of the drug, this is the dose of the drug, this can be the frequency in these doses, this is approved like this. So pharmacopoeia and formularies, these two are different types of the drug compendia. Compendium is a singular, compendia is a plural form. They are brought out by the government in a country. So in our country there is Indian Pharmacopoeia. So when you will get home, you can see any tablets that is present in our house. For example, paracetamol, you will see that Calpol. Calpol is written, below this it is written the international non-proprietary name paracetamol, and then it is written IP, that is the Indian Pharmacopoeia. So in this Indian Pharmacopoeia, it is written what will be the composition, what will be the content of a drug, etc. Similarly, in different other countries, like in British Pharmacopoeia is there, United States Pharmacopoeia is there. So this Pharmacopoeia formularies are brought out by the government in a country. They hold legal status and are called official compendia. In addition, there are some non-official compendia also there, that is published by professional bodies, that is some societies of the doctors, some societies of the medical practitioners, etc., which may be supplementary and dependable sources of the information about the drugs. So pharmacopoeia, what is pharmacopoeia? They contain description of the chemical structure of the drug. For example, in the pharmacopoeia, it is written paracetamol. Now, what is this paracetamol? What is the chemical structure? What will be the molecular weight, ideal molecular weight that should be marketed in our country? What will be the physical and chemical characteristics, solubility of the drug, identification of the drug, assay methods, how these are assayed, standard of the purity, storage conditions, how it should be stored, in what temperature it should be stored, dosage forms, what dosage forms are approved in our country or in some other countries, officially approved in a country. All these are included in the pharmacopoeia. So this is the definition of the pharmacopoeia. So pharmacopoeia contains description of all of these. So they are also useful to drug manufacturers and regulatory authorities also, but not to doctors, most of whom never see a pharmacopoeia. So basically this pharmacopoeia is needed for the manufacturers as well as the regulatory bodies. So when a manufacturer will manufacture, they will see the pharmacopoeia, there will be then what dose and what solubility, purity, etc. should be maintained, and when they are applied for the permission for the marketing, the regulatory bodies also check whether these are in agreement with it or not. So Indian Pharmacopoeia is there, British Pharmacopoeia, European Pharmacopoeia, United States Pharmacopoeia, etc. there. So this is known as the Pharmacopoeia. Next, coming to the formularies. Formularies is generally produced in easily carried booklet form, that is small booklet type. They list indications, dose, dosage form, contraindication, precaution, adverse effect, and storage of the selected drugs that are available for medicinal use in a country. So these formularies may be useful for our doctors. So formularies is a pocket form that is also usually published from the officially and also different other recommending bodies that contains, that is paracetamol, what will be the dosage of the paracetamol in different indication. These are the indication, these are the diseases, these are the doses, this should be the frequency, etc. These are the contraindication, that is when this problem is there, this drug should not be given. Precaution, when this drug is to be given, we have to keep in mind that if there is this problem is there, we should not give this drug, or we have to decrease the dose of the drug like this. So dosage form, that is whether it should be given orally or injectably, etc. contraindication, precaution, adverse effects, storage of the selected drugs that are available for the medicinal use in a country. So drugs are categorized by their therapeutic class. Therapeutic, there are different types of therapeutic class. Some rational fixed dose drug combinations are also included, that is 2 or 3 drugs in combination when it is used, rational use of the drugs. A brief commentary on the drug class and the clinical conditions in which they are used generally precedes specifics of the individual drugs. That is for the group of the drugs. For example, antipyretic drug, that is those drugs that decrease the fever, and then the different types of the drugs that comes under the antipyretic group. So brief guidelines for the treatment of the selected conditions and informative appendices are also provided. So fever is also in the different form. For example, when there is typhoid fever, apart from this paracetamol, we have to give the antibiotics also. So there may be some brief guidelines also can be included in the formulary. British National Formulary, example, that also lists some brand names. There may be some national formulary of the India, but it usually does not contain some brand names. Again, so for different countries, different types of the formularies are there. There are some changes of the different types of the formularies. So in the India, there is National Formulary of the India. Pharmacopoeia is the Indian Pharmacopoeia, IP, and this is the National Formulary of the India. So pharmacopoeia is mainly used by manufacturers as well as the regulatory bodies. Formulary is mainly needed for we the medical professionals. So pharmacologies can be considerably helpful to prescribers. So there are examples of some drug compendia like Martindale is quite older drug compendia, the complete drug reference, also known as the extra pharmacopoeia, that is published every 2 to 3 years by the Royal Pharmaceutical Society of Great Britain. This is the non-official compendia, widely used, extensively used throughout the world, that compiles the unbiased information on medicines used registered all over the world. It also includes new launches and contains pharmaceutical, pharmacological as well as therapeutic information on drugs which can serve as a reliable reference book. There may be some physician desk reference, some drug facts and comparisons. These are published from different other countries also. This all comes under the drug compendia. So drug compendia is also important. And apart from this, if we want to know about the clinical trials or different types of the analysis of the clinical trials for new drugs, there may be different types of the websites, different types of the journals are there. We read about this, all this about how the information about the drugs are got. One of the most important drug information what we can get is from the different types of the drug compendia. Apart from this, there are different other ways from which we can get the drug information. So thank you. This is all about today's introductory class. Today's class from there is very important is what is the definition of the drug. This is very important. Definition of the pharmacokinetics pharmacodynamics. What do you mean by pharmacokinetics pharmacodynamics? Other definitions can also be asked, like what may be pharmacy, what may be pharmacotherapeutics, what do you mean by clinical pharmacology. Details about the clinical trials, clinical pharmacology will be taken later. Then there may be some questions may ask from what are the different types of the drug sources. Lesser used, question, but it can ask. But again, most important is the drug compendia. What do you mean by pharmacopoeia? What do you mean by formulary? What is the difference between the pharmacopoeia and formulary? These questions are very important. So first, again, I am welcoming you all to the second professional MBBS. Please start learning and happy learning to all of you. Thank you.